Hey guys, it's Brogan with What's Good For You. I'm here today with Dr. Bhagwandin, and we are talking about a very important topic today, and that is colon cancer and the fact that so many younger patients are starting to see it.
Yeah. Colorectal cancer is the third most common cancer that we see in this country, and even worldwide we see it as a prevalent disease, and it's the second most deadliest cancer. So it is an important part of awareness and a conversation that needs to be brought forth. The trend that we're seeing is that older patients that are actually getting screened, typically by colonoscopy, we've seen a decrease in the incidence of colon cancer. However, in patients under the age of 50, we're seeing an increased incidence as high as 2 to 4%.
So right now, what age is suggested to get a colonoscopy?
With average risk individuals, patients that don't have symptoms, the recommended age is age 45 for a screening colonoscopy. There are other tests that can be done, typically stool DNA testing and send-away tests that patients can have done annually. But colonoscopy is typically the gold standard that we recommend to get screened, not only for colon cancer, but to detect the polyps that ultimately are precancerous or can develop into cancer.
Which I have had a colonoscopy before, and I will say, yes, the prep is hard, but the procedure itself, super simple. You don't even know what's happening. It's what, 10 minutes? I don't know. I was out.
Yeah, I would say it's a very straightforward test. Obviously, we do use the phrase that the best test is the one that gets done. And interesting to this diagnosis and that trend that we just talked about, particularly with younger patients, is that this is toilet talk that needs to be brought to the dinner table. I had a colleague that used to say that you shouldn't die of fear and embarrassment. And a lot of that is really with the younger age, particularly with regards to symptoms, which we'll talk about. But it's why a lot of this disease, in my opinion, sometimes gets missed or presents at a later stage, is that people don't talk about it, or honestly, we as physicians may not recognize the importance of certain symptoms that patients are having because they're, quote, too young for the diagnosis.
Right, absolutely. And you made a great point. I think it is extremely uncomfortable. I mean, it's not something the younger demographic likes to talk about, especially with other younger people. So you mentioned 45 is the age, but you know, with this trend in younger people, what age would you maybe say that you really should start, maybe go get a colonoscopy?
Well, if you're having symptoms, that primarily is a reason to talk to your doctor to persist, particularly, and just to allude to those symptoms, it's primarily any change in your stools. If they're narrower, they're becoming less frequent, any associated abdominal pain, weight loss, blood in your stool. The thing about colorectal cancer is that those symptoms end up being vague and they're not always present. So a lot of it is really having that dialogue with your doctor to see when is the best recommended time. There are patients that are higher risk, meaning they have a family history. So knowing your family history is key to really being evaluated to see when is the appropriate time to get it if it's not at the recommended age of 45.
Okay, so let's just say, if I can, when would you say is the time to be like, okay, let me go to my doctor and let's figure this out?
As soon as possible, and I'll tell you why. There are studies that show that patients under the age of 50 end up being seen by their doctor and evaluated for colonoscopy at least 2 months later than patients over the age of 50. And a lot of it really speaks to why this delay in diagnosis can occur. But honestly, as soon as you have symptoms, if you're having symptoms, there's no harm in at least prompting that conversation, even with the primary care, to facilitate the referral to a gastroenterologist who can decide, obviously, with you or follow those symptoms to see if they've become persistent or resolved. But again, it really is the conversation, and why I say it needs sometimes to be at the dinner table is that it's just the awareness and talking about things like colon, rectum, anus. You might get a giggle, but honestly, a lot of it is just having the bandwidth to really have that discussion and really understand why this is such a common diagnosis.
Right, and I think that, I mean, could it be even anyone in their 20s?
Yeah.
Their teens?
Yeah, I mean, we see this diagnosis with genetic predisposition, meaning patients that have a family history of that cancer can present at an earlier age. So knowing that family history can sometimes prompt why colonoscopy sometimes can even start as early as age 20.
Wow.
But it's not that common that with regards to average risk. The primary risk factors that we see contributing to it are just a poor diet. And that's really the question, well, why are we seeing it in a younger population if the trend is that the older age individuals that are more at risk are noticing a decrease? And it has a lot to do with a lot of the processed meats,
That's
feed,
exactly what I was going to say.
you know.
Processed foods nowadays.
Exactly.
So more consumption of that type of thing could
Yeah.
maybe lead to this.
To colorectal cancer, yeah. And just having a healthy, well-balanced diet, exercise, avoiding smoking, alcohol, not being sedentary. Those are things that we've identified as risk factors, but probably what are contributing to the risk factors in this country and why we're seeing that trend in younger adults.
This is such important things, and I really appreciate you taking the time to talk with us today. And I mean, it is true. Younger people, I think that we just think we're invincible and it's not going to happen to us, but you guys should absolutely get tested if you need to. Speak with your doctor, bring this to the dinner table, and I hope you guys learned something today. I did as well, and that's what's good for you.